Good evening, guys. I've got discussion D for you. We're discussing chronic venous insufficiency, or CVI. It is a condition where the veins in your legs struggle to return blood efficiently back to your heart. The surrounding page focuses on a diagnosis made public about former President Trump, highlighting how CVI is typically caused by age-related changes. As people get older, vein walls and valves can weaken, making blood flow less effective. Weight and circulation issues. Excess body weight and reduced physical activity can put extra pressure on leg veins, and leading to swelling or fatigue. Leg discomfort symptoms. Common complaints include tired or heavy feeling legs, and noticeable swelling, especially after long periods of standing or sitting. Dr. John Torres, cited on the page, notes that CVI in itself isn't necessarily alarming, but it may be part of a broader circulatory or metabolic concerns worth monitoring, especially in older individuals. If you are exploring this from a clinical or public health lens, CVI also intersects with frailty matrix, mobility design, and chronic care planning. Definitely something relevant to your work in equity-centered elder care. Want to dig deeper into CVI's intersection with smart housing or collagen-related resilience. Chronic venous insufficiency, CVI, is a slow developing condition with a mosaic of contributing hold on a second. Factors. Here's a detailed look at the specific risks that can tip the scales. Primary risk factors for CVI: aging, vein valves lose elasticity and strength over time, slower circulation and muscle tone decline contribute to blood pooling in the lower limbs. Obesity and sedentary lifestyle, increased pressure on leg veins, lack of movement, weakness, weakens calf muscles, which play a key role in pushing blood upward, family history, and genetics. Okay. If your parents had vein disorders, your risk climbs due to inherited valve structure or weakness. History of deep vein thrombosis or DVT. Okay. Previous clot can damage vein valves permanently, leads to impaired blood flow and venous hypertension, prolonged sitting or standing, occupations involving extended immobility like nursing, teaching, truck driving, increased venous stress. Okay, then you got pregnancy, hormonal changes, and increased blood volumes, strain leg veins. Okay. Uh, urine pressure adds resistance to upward blood flow. Smoking and vascular health. Nicotine damages blood vessels and worsens circulation. Accelerates inflammatory changes in vein walls. Clinical insight for you. Given your deep engagement with aging, resilience, frailty aware care, and occupational therapy, CVI long-term effects on mobility and cognitive fatigue are especially relevant. Its influences gait, stability, and fall risks, especially in older adults with comorbidities. Smart housing design considerations, e.g., adaptive seating, compression supports, activity-friendly architecture, collagen integrity, which plays a role in vein elasticity, linking directly to your interest in nutritional support and connective tissue health. Would you like to explore how CVI management strategies like guided compression, aquatic therapy, or anti-inflammatory diets intersect with therapeutic housing environments or predictive elder care tech? Long-term effects of chronic venous insufficiency, unfold gradually but can become quite disruptive if not properly managed. Here's a comprehensive, okay, hold on a second, breakdown of how CVI can impact health and daily life over time. Physical consequences: venous hypertension, persistent poor blood flow raises pressure in legs, veins, damaging vein walls and valves further. Okay, skin changes and ulceration, hyperpigmentation, darkening of the skin around the ankles due to iron deposits, lipid dermatosclerosis, hardening and tightening of the skin and fat tissues, venous ulcers, painful, slow healing wounds, unusually near the ankles. Okay. Swelling and discomfort. Chronic edema becomes harder to manage, leading to itchy, cramping, and reduced mobility. Cellulitis risks. Damaged skin barrier makes infections more likely, with inflammation spreading into deeper tissue. Okay, functional and cognitive impact for older adults and those with frailty. Indicators like those you're researching, CVI can contribute to mobility restrictions, weakened circulation, affects gait, confidence, and independence in daily activities. Okay, folks. Be right with you. Fatigue and cognitive load. Discomfort and sleep disruption may contribute to cognitive fog and executive function decline. Environmental and care implications. Smart housing adaptations. Compression garments, situations, mobility aids, and alert systems may become necessary as CVI progresses. Caregiver burden, ongoing wound care, and monitoring require sustained support, emphasizing the need for scalable care plans. Social withdrawal. Visible skin changes, discomfort, and fatigue may reduce participation in social or community life, biological intersections, given your focus on collagen health and aging resilience. CVI's link to collagen degeneration, weak connective tissue contributes to vein incompetence and skin breakdown, inflammatory cycles. CVI may perpetuates chronic low-grade inflammation and undermines vascular and natural resilience. Okay. Would you like to explore evidence-based interventions like aquatic therapy, nutritional protocols for vascular integrity, or how predictive tech could monitor CVI progression in frailty-aware environments? I think you'd spark something quite innovative there. Okay, guys, so that is D for you. I'll see everybody tomorrow for shows. For now, Gator Wellness. Take care, folks.